and welcome to What Would Larry Do? I am Dr. Ann, and I'm here with Larry Hellwig this morning.
Hello. Hi, everyone.
Good morning on this Friday morning.
Yes, good morning to you too.
Thank goodness it's Friday.
That's right. I got a big weekend plan.
I know. Well,
So-
you'll have to tell us about that in a bit. But first, I'm
Yep.
going to introduce our special guest today. We have Dr. Anil Rajani on with us today. He has been in
Good
the
morning.
aesthetic industry for over 20 years. He is definitely one of the top injectors in the United States as far as the aesthetic industry goes. And he's one of the most sought after trainers in the aesthetic industry when it comes to injectables. So we are very blessed to have him on this morning.
Hey, he's a rock star in the industry. Okay, that's
Literally a rock star in the industry.
Tell it like it is. That's what he is.
Well, my day's complete. I can go home now with that introduction, feeling great about myself. I appreciate it. You guys are very kind. Good morning.
Good morning.
Good morning. It's nice and sunny here. I probably can't say the same for you.
No, and we get frost in the morning, and then maybe we hit 50 in the afternoon, but we still go around in t-shirts. That's how it is. It's like we're impervious to the temperatures. So
That's how you know when you're from Arizona, it's 50 degrees and we're in a parka.
I hear it all the time. I can't believe it. Yeah, you're blessed.
Well, we have a fun topic today. I'm really excited about this because this is something that we just introduced into our practice this new year. So we're going to talk about Easy Gel. So
Wonderful.
the first thing I'm going to do is because just from being a trainer and being in different environments, people ask me a lot of times, what do I do for under eyes? And I always tell them PRF. And their first response is, what the heck is PRF? So first, in a brief description, because I always have to say, well, it's like PRP, but it's different. Tell us a little bit about PRF.
Yeah, PRP, a lot of people know about it because it was the first kind of blood product used, and we still hear about it in shoulders and in dental applications. But that had some additives. It had a kind of a plastic separator plug. There's heparin and blood thinners, and that enabled the product to stay in a liquid form. As technology improved and we realized, hey, we want the least amount of additives possible. We don't want anything in the tubes. We don't want blood thinners to kind of mess with our own body's healing systems. If you want to think of it, less is more. We learned how to do a slower spin speed to maintain the liquid without adding additives like blood thinners. So it's more natural, still packed with growth factors. It takes a little bit on the practitioner's part to spin it properly and to keep it in that liquid form. But we find the growth factors and the overall results better because it is allowed then to clot in the body.
Mm-hmm.
And that clot allows the slow release of growth factors. PRP with the blood thinner won't clot. So it's the new generation of blood product.
Yep. And I really feel like for me in my practice, it was a game changer for the under eye treatments. I really have, in the last 5 years, I pretty much don't do filler in the under eyes at all anymore. And that's, I would have a few patients where sometimes I felt like the volume was depleted enough that I wanted a little bit of something. But I have switched in this new year since January, beginning to use Easy Gel. So tell us a little bit about what Easy Gel is.
Yeah. So again, we wanted to stick with 100% all natural. So there's no additives. That was really important to me because to your point, the under eye particularly is where we struggle with other products. And it's one of the first areas to age is, of course, is what people want to address. What we wanted to do is actually add more gel. So trying to figure out how to do that. Well, in the body, we have something called albumin in the blood. If we separated it, which we figured out how to do, and then we heated that albumin part, then we could add the PRF back to that gel. So it's all natural, but it takes one extra step, which is heating part of the blood product, but it keeps it natural.
Yeah. And actually, they'll show a little video. So I was injecting one of my patients yesterday, and there are a few different steps to it. So the first one is, drawing, spinning. You'll have the albumin portion. The second one is the one that's a little bit, I call it my rosé champagne, which is the PRF portion. So you got to mix a little bit of Chardonnay and rosé together, which I know would be a faux pas in the restaurant industry. But
I love that.
But here, this is where then mixing it together does create more of that gel that's going to be, have more of, be thicker for the product when we're putting it in and give the patients more, and it gives us a higher yield of product, which I guess you can kind of talk about too.
And this you're using in place of just plain PRP or in some cases filler. Is that correct?
I do. I mean, first of all, that's that topic we could talk about for a while. But I think, because there's a lot there, honestly.
Yeah.
And when I started doing this, I'll try it. And then as you start going down this rabbit hole and you see the results, it kind of expands and explodes in your mind. But we have to keep in mind, I calculate 97% of all potential patients don't come into us because they don't want filler, they don't want synthetics, they might have
Yes.
autoimmune disorders. So yes, it allows it to keep all natural. It does add more volume, but one of the keys to think about, that gel, the growth factors and the stem cells that are in our body already, if we could suspend that longer and expose the skin, the bone, the tissues to it longer in that gel, and we know the gel heated lasts 3 to 6 months plus, then we're just letting the growth factors sit there in a milieu, in a matrix for a longer period of time. So yes, volume. So yes, it suspends it for a longer period of time. But it also gives what people want, which is volume for a period of time. And the idea is, as that matrix is broken down naturally by your own body, those stem cells and growth factors kick in to rejuvenate.
And there you're getting skin rejuvenation as well, correct?
100%. And again, my mind is like this every day as I think about it all. But there are a few main growth factors: vascular endothelial growth factor, and growth factors that help promote collagen. And when people really understand this, I think it just changes. This changes the world, but it honestly is going to change how we think and how people think about it, because absolutely, the skin is then exposed to, just take vascular endothelial growth factors. You get more blood flow to the skin, as we know with skincare, massage, all those things. The skin improves, and then dripping your own growth factors. Definitely get nice skin. But also, I think the fat layer is a big component we have to look at and think about. Bone, we know from dentistry. I really believe, to your point on the under eyes, we're doing a lot with the fat and lymphatics.
Yes. Yeah. And, for me, when I brought the Easy Gel in the practice and started using it, the first group of patients that I was reaching out to were, again, under eyes, where I felt like they needed a little bit more correction than what I was giving. And then the patients who did not want filler, where they come in, they need a little bit of help, they really don't want to do it. And those who are the ones I've been able to sell on it, and they've been very happy. So it's like,
Do you have those in Arizona that don't? I mean, as you go to certain parts of the country, and I am being funny about it, but I'm also interested in your feedback on it, because obviously, as you come up towards the Northwest, a huge contingent don't want
yes.
to look on it. As you go to certain parts of the country, I'm going to be very fascinated to see how the demographics are in the country. Do you find in Arizona that you still have people coming in not wanting anything in their face that's foreign, or what?
Yes, or more importantly, they are very concerned about looking unnatural, because we have the huge population, especially in Scottsdale, that is that housewife population, meaning like the housewife TV show population,
Yes.
where they look
Yes.
very overfilled, very overdone. And our patient base are the ones who come in and they want to do something, but they absolutely do not want to look like that. And
They
so
know what they
They're
don't
scared.
want.
yeah, they're scared.
They're scared. Yeah,
And so
it's
they
like
actually sometimes won't do anything because they're afraid they're
Yeah.
going to look like that. And this has been amazing.
Yeah, so you see that too, and I'm learning too, because you got to understand, when I come to those areas, I have to adapt. Every place I go, even different countries, as you guys do too, we have to adapt our treatments to the population, what they want. But so I think, to answer your question, yes, it's volume, it's growth factors, it's all natural. And here's the beauty of it: you can add it to your existing products. So if they have PLLA, if they have fillers, if they are doing devices, it works. And one of your prior questions to address it, is it taken over from my PRF liquid? In other words, I'm only doing gel. No, because I still use the liquid for, say, hair growth, where, okay, I can do the brow. I can take an extra tube, do the brow with the liquid, give it a little projection. And I can even layer liquid on top of the gel. So when you start just drawing blood and spinning down. There's so many things we can do.
It's funny that you talk about that brow because I can't remember where we were that you were doing the training, or if I was watching you talk about it on one of your YouTube channel things. But you were talking about how back in the day, patients used to pay you for hair removal on their brows, and now they're coming back and paying you again to inject PRF to grow the brow back.
It's very interesting because a lot of people think, you know, med spas, aesthetic practices, plastic surgery, they're all trying to make all this money. And it's money driven. Certainly aesthetics is a component of that, but it's interesting what the public wants changes all the time. And I don't know who creates this stuff, but it just by nature, this industry is growing. So it is fascinating. What we've done 10 years or 15, 20 years ago, we're undoing now.
Yeah.
So I put it towards the stars of the world, you know, what would you call them? The main influencers in Hollywood.
The influencers.
they're creating our work, I suppose.
Yeah, no, they are. And it's I always say I have a love-hate relationship with influencers sometimes because sometimes some of the stuff is a little ridiculous or not going to do that, but it brings patients in my door and then I can have a conversation with them of here's what we can do or here's what will actually look better if we do that versus trying to create an unrealistic image.
And that's what I try and do on my YouTube is create that reality. You know, reality doesn't grow like a disconnect grows. If I was up there sensationalizing, I'd be 5 times bigger.
Yeah.
But my ultimate goal, and I know your guys' goal because I've known you for a while, is the reality of the situation, the reality of the results, the reality of what's possible and not possible. So I commend you guys, and I appreciate your guys' relationship over time because creating the narrative of what really is and understanding also that this type of a product, and I think it's very easy for people to get their head around doing it. We don't want to create this blown up face, but by nature, it won't do that. So if you're looking for that, this is not the genre of product you want. So it's really going to, I'm sure, fit as you're finding into your practice as well.
Yeah, well, and for one of my patients who, when we did our weight loss after your certain age program, where she was in her early 60s, had a significant weight loss over 1 year. Her face was so volume depleted that I had to go to PLLA. Like there was nothing else that was going to help this lady. She already looks so much better in the face. We're working on her body as well with the laxity, but there are cases where I then go to, I'm like, she actually came in wanting me to put a bunch of like HA filler all through in here. And I was like, oh no, there's so much gone. And once I explained and did the whole lift thing, oh yeah.
Yes.
But we've
and
already,
certainly it's going to reduce the need for that because in a year or two, she comes back, wants a top up. Now you can go towards the all natural, towards the easy gel. So yeah.
Yeah. But I guess that answers one of Larry's questions because we were going to question you about whether or not you were switching to this for hair growth.
Well, you know, there's another 2-hour topic because we're seeing telogen effluvium with post-COVID, post-C19, of course, androgenic alopecia. Yeah. And I was shocked when I started doing this type of thing for hair 10 years ago. I thought I was just doing my buddies and my friends. They'd come in and let's try this. And their hair was growing. And now it's by far more females come in than males for this, which shocked me. And now we have all the data now that we post C19 that we can apply to these poor people who, and I have a lot of them that seem to be losing hair because the hair's kind of stuck in that dormant phase. So I just did a bunch this week and last week, but I still do use the liquid for that, but because I'm not trying to volumize, but this is evolving and I don't pretend to know everything about it, but you can certainly make a case. The liquid's nice because you can also microneedling it, you can inject it, but certainly there's no reason you couldn't use the gel with the idea of suspending it. I think we'll learn as time goes on. Have you tried to use the gel a little more in the hair?
I haven't yet. That was going to be one of the questions. I've been using it in the face and I've also been using it in the buttocks for cellulite. So where some of the it's like part skin tightening, but part filling a little bit of the volume. So I've been experimenting on patients with that as well.
And I think the other thing you can do is play with it to the point where instead of doing a 1.5 cc to 3 cc of albumin, you could go 50-50 or 20-80, 20%, 80%. So you can create the kind of milieu you want
Yeah.
just add a little bit of albumin to make it still injectable through a needle, but also sit up there long and hang in there long. And I think as people start playing with this, we're all going to learn more.
Mm-hmm.
Yeah,
Yeah. And
excellent.
and when you look at this and you're selling it to your patients in the practice, who do you feel like is a good candidate for the Easy Gel?
Honestly, and this is one of there's only a couple of products that you guys will probably think of a couple too, that you can say everyone, but really
Yeah.
it's everyone. I would say there's only one person, because a lot of times we don't do things for autoimmune disease
Mhm.
because people are maybe getting post-cancer radiation, different things where we're considering their immune response. I don't personally worry about that in this case because I've done a lot of it and we're not worried about the body in general attacking itself like an autoimmune disorder where we may have to do some treatments. But there is one patient, I think, if the patient does want this huge cat cheek or they want the big lips, maybe a jawline where I want more G prime, more force to create the jawline. Those are the only ones, but I always like to combine it because to me, the less other products I put in and the more all natural I can do, I tend to do that. But those would be some examples. But other than that, I've been using it, mixing it differently, putting in necks are wonderful, and you
Mhm.
can add some biostimulators if you want, or keep it all natural and add it in the neck, do a device on top, and then put the liquid on top to help the healing and then send them home with growth factors. So most people are candidates, which is kind of cool.
Yeah. No, that's excellent. And that's what I've been kind of selling it as well.
Mm-hmm.
Because really they are. It's very safe. It's really only their body. And that's one of the things that I think is hard for patients to realize sometimes. But once you start explaining it, you're like, I'm going to draw your blood. There's 2 different tubes. I'm going to heat one. I'm going to cool one. We're going to mix them together and I'm going to inject it back in and nothing is added. And so it does help them be more comfortable doing the treatment, knowing that. And as a provider, getting used to it as well and setting that proper expectation. Because I would agree with you, unrealistic expectations would be our primary, not a good candidate for this procedure.
Yeah, and I do all of these in 2 sessions. So
Mm-hmm.
I'll do 1 session, repeat it 6 weeks. I always look
Yeah.
at that as, hey, the worst case scenario here is that they're happy at 6 weeks and we skip that appointment.
Yeah.
That's pretty cool.
Yeah.
And they can then do it in 6 months or a year. It's on the books. But I like to set the mindset up that for me, everything's 2
Mm-hmm.
because each body's different and we never know exactly the response and the mentation of the patient when they see, oh, I just want 20% better. And when they get that, next thing, of course, they want the next 20%.
Yeah, which is funny. In our
So,
last podcast, we just talked about people underselling patients.
Yeah.
yes, yes.
Would treating breasts ever be a possibility? Do you do any of that, or have you thought about it?
Yeah, a little bit. I think the problem, I mean, I'm so busy doing faces and then and
Yeah.
necks and then décolletés and then arms and knees. But I think that especially the right type of practice who has that kind of a conversation with their patient, I think it sure beats putting filler in. It sure beats putting PLLA. I think threads is another kind of conversation. But I think we have to realize we're putting fat in breasts. Okay, great. Fat has the highest concentration of stem cells, mesenchymal stem cells. So PRF is less. We're concentrating it from the blood. But I think that is our basis for doing it. And I think, yes, I don't know the exact results. And part of the problem is people that want the breast lifted, let's say, often come in as a size D or large C. So their expectation, but in the trainings and when we do them, the happiest people tend to be the B, small c, of course,
Yeah.
A. So it's patient selection, I think, as Anne was,
Yeah.
alluding to. But yes, I think it would be a great one.
Okay.
Yeah, and we have some before and afters that we can throw up too, where we've got a couple patients. Some of these are immediate post-injection, but they start to give the patients the idea of what's going to happen. So you can see your left is your before, your right is your after, and her side view is really good as well. So some of these patients were people who didn't want filler, they were lacking that volume, and just really helping to give some of that lift, but overall skin rejuvenation back. This is an under eye, and she's still a little swollen post injection, but
Yes.
under eye and that lateral cheek volume. Even in young people, this tends to be a common issue, and it's actually aging to them, even though this patient is obviously very young.
Yes.
And then the eyes. This is one of my favorites. So you can see there's before, immediately after, and about 6 weeks out. And so this
Yes.
is the one treatment where it's like you said, you set them up for 2 and it's going to be a home run.
Yeah. I think, satisfaction rates when you choose people correct, when you do it or have at least one more session that you can do after the first one. I mean, I would have never have thought 7 years ago when I started playing with PRF that we'd have satisfaction of, I'm going to say 90, but I feel comfortable going to 97% satisfaction.
Mm-hmm.
And so you showed the under eye, that's great. Interestingly, I've treated young people. I started with this gel. We're over a few hundred patients now. And I started with younger people because I wanted to see what it would do in the home run patients before moving to the 50, 60, 70. But I did a lot of cheeks, a lot of lateral high cheeks, like in one of the pictures you showed. And I was surprised at how happy the patient was and the amount of volume they got in a high lateral cheek, which
Mm-hmm.
is traditionally a filler area.
Mm-hmm.
So I definitely removed my mindset of the fact that this won't volumize
Mm-hmm.
and that the younger patient won't be happy because they are very happy. Sometimes we think the younger patient, they just want the filler, the high contour cheek, and we can get very nice results with this as well. So those pictures are very indicative of what we see.
Yeah. Now, in the patient that I treated yesterday, that's exactly what I did. Is I did her under eyes, her high cheek, and then I had a little bit left that I just threaded into her smile lines.
Don't you love that little bit left?
Yes, I do.
One of them, I remember doing a cheek on the younger girl. I'm thinking of younger. I'm gonna like 28 or so, and I did cheek. I said, "Hey, there's a little left. What do you want?" And I do 3D imaging, or we measure volume, so we know what we're looking at. And this really bothered her, a little smile line. So I injected that, not thinking too much because it's dynamic, and as you know, it's a tough area.
Yes.
And we brought her back at about 4 or 5 months. She said it's gone. I said, no way. It was gone. We did the 3D imaging. 3D imaging showed it too. And I have those 3Ds in my lecture. But you get, as you're learning of the power of the body, it kind of blows your mind a little bit about the results you can get. So yes, even in dynamic areas, the skin and the back.
Well, and that's where I've been feeling more comfortable using it because I think you're kind of like me. I hate filler right here in this very dynamic smile line. It makes people look like a chipmunk packing for winter, when they smile, if they put a ton of filler there. And it's just a dead giveaway that you've had something done. And that's my little bit left over because that's the other thing we really didn't get into too much detail. But with one kit where I draw 2 tubes, my yield is typically between 4.3 to 4.8 cc's. I don't know where yours tends to fall.
100%.
But that's
100%.
right where I've been getting. And if you take most injectors and say, I'm going to hand you 4.3 cc's, what do you want to do with it? And it's like, well, good. The patient's willing to do all this product right now.
Yes. And I think for viewers or people watching or listening, understand, I mean, I'm fortunate. I get, and as you guys are in a training center, sometimes we get the ability to treat full faces because that's what we do in real life. For people listening, understand that most people coming in are still believing the average in this country is like 1.4, 1.5 syringes is what's purchased. And when I'm in a situation where they're like, give me all this stuff, they're like, do whatever you want, doc. We can really make a difference. But I think the thing to think about is to exactly your point. You've now got 5 cc's. It's the opposite of making them look unnatural because what am I doing now? I'm addressing the eye. I'm doing the high cheek. I get to do a little in front of the ear. I do the smile line. I can do the lips. I can do the brow hair. And now all of a sudden, the patient looks naturally rejuvenated. And people think about, 5 cc's, you're going to look crazy. It's the opposite. They look more natural. And so I want people to realize that the more we do with a good, prudent provider, the more natural you're going to look. To a point. I don't mean that literally but having 5 cc's is helping us make people look better, not worse.
Yeah.
Well, and people have lost volume everywhere. And so when you have the opportunity to, if you just go in with one syringe and do one area, yes, you're going to improve that area. But when you get to do everything, because in many cases they've lost everywhere. So big benefit.
Yes.
Yeah.
Yeah. And the volume loss, I think too, people, we are always educating, but understand people don't want to watch those. If I throw up a video educating about bone fat, I might get 5,000-10,000 views. If I throw something up with a little bit more flair to it, 100,000, 200,000 views. But it to people listening, understanding that, hey, it's fat, it's bone, it's muscle. What you're trying to do, what we try and do every day, is a very difficult job. And if you have 1 ml to try and do that with, it's very difficult. So understanding what we're doing, it's amazing what we can get done with 5 cc's, even though people ask for 1.
Yeah.
And when we move to that 5, it's a game changer.
Yeah.
Mm-hmm. And have you done anybody's lips with this so far?
I do actually a lot of lips.
Okay.
And again, I'm slow. So I just started treating them, with the gel, of course, about over a year ago. So I've done it for plasma lip. I've done lips for years, but now with the gel. So even because people are scared, I'm going to take my 55 plus, haven't done anything. They're coming in because they want it all natural. So they're tuned into their lips. They don't want to look weird. They refuse to do anything with lips because of what they see. Great. I kind of press them and I'm like, it's all natural. We're going to do it for vertical lip lines. And you guys know how difficult they are. Sometimes we got to resurface. They're in the skin.
Yeah.
But as I saw the results and the vertical lip lines and the patients were happy, I'm like, there's no way it could have done that much, because Dr. Ann, to your point before, the skin does improve. I do almost everyone vertical lip lines for the top, the border, and then if for the patients who are more adventuresome or who have lip filler or who aren't scared lip filler, I definitely add it in the lip body, but always with a cannula. So I started slow and now I do almost everyone.
Okay. That's good. I've had a few patients ask about that, and that was kind of my thing. I was like, well, I'm willing to try it. I wasn't sure. Lip lines I was going to go for, but lip body. But I have a few people I do want to try it on where they don't necessarily need too much, but we're going to, see if we can improve the lip. Or have you seen anybody get like improvement in the color of their lips with doing it?
That's it. And that's it. The two that, of course, again, if people want the big lips and the fish lips and the volume, I'm not reaching for this product.
Yeah.
But I do reach it for when I think they have too big lips and they want bigger lips. Going through this scenario, we're trying to hold people back. We love our patients.
Yeah.
We know they're going to go somewhere else and get it if we don't.
Yeah.
So I've kind of convinced them to use this. And what they like about it is, hey, I have more color, and color is an attractive feature. It says estrogen, it says youth. So color is important to bring back, but also just the fine line on the lips.
Yes.
Yeah.
So yes, it's not your number one volumizer. It does give you, I believe, nice volume, but it's such a natural look.
Well, maybe Larry can be my first candidate for the lip injections.
I love that. I'll even fly down for that one. If you agree to that, I'll do it for you.
I've been a victim before. So.
Dr. Ann does one side and I do the other. We do the challenge.
Oh God.
See, Larry? I mean,
yeah.
You say I never treat you, but I offer to you and you decline.
I'll do it too. If Larry does it, I'll do it for sure.
Oh, see? Yeah. Now you've got a challenge.
Okay. All right. The next time you're down at the office, maybe we'll do it.
The YouTube people love to see me get that plasma lip, and we'll do the challenge, and we'll see whose pain tolerance is better, because we know men, we don't do so well with it, but
well,
we'll see, Larry.
How do I suck on Pronox while getting my lip done? I'm not sure I can do that.
That's called cheating. You're not allowed to have analgesia.
Well, since you've been to our office last, we've installed a new camera in that big training room that is precision point, so we could actually film it while it's going on
Yeah.
with high-tech camera. So
I mean,
I'm always so jealous because you have all the things down there that I want.
you can zoom in on an eyelash. I mean, it's like so incredibly perfect and clear, and it just rotates. It's all just, motorized. It's beautiful.
You know, the day I retire, I'm just coming down there to work with you guys. That's my ultimate retirement plan.
Well,
Just
go
come
ahead.
down there.
This would be a good year to retire. It's like we'd love to have you.
But I do have one question that I know viewers are going to end up asking is what are the risks of doing Easy Gel? Because every patient, first they want to know what are the results, then they want to know the cost, which I'm not going to get into on here, but what are the risks?
Yeah, and I think it's important to know everything has risks. And I think, of course, I think number one, looking unnatural. Okay, let's not call that a risk, but we'll go into some deeper risks. And the number one thing people are going to ask about, let's go right to the depth of it. Two, number one, migration. This is what I hear all the time. Okay, so it's all your own stuff, so we don't worry about migration, never seen it. But let's go into occlusion real briefly because people are worried about death of the tissue. Because if you inject products, they can go into a vessel or maybe compress the vessel, you lose blood supply, and it kills the skin. Okay, now I think it's important to think of a couple things. Number one is filler has something unique that causes spasm. Okay, so if you were to clamp off the facial artery, that would be a better outcome than putting filler in it. So what's filler? Why is filler making these spasms or necrosis or death of skin worse? And we don't know the answer to that. But filler, so you can't equate it to filler because I think filler has special properties when it comes to occlusion. Great. We have a dissolver for filler. So most times you can dissolve it, goes away. People worry about this. How do you get rid of it? First of all, there has never been a reported case in the world. Okay, so that is comforting. You might say, well, there hasn't been that many injections done as with filler. Great point. We're always learning. However, think about what I told you about with the filler. We don't have that. Whatever's causing the spasm, that's one thing. Number two, there are things we can do. We're investigating certain products right now, enzymes that could break down the albumin. We're not there yet. At least I'm not. I don't know of it, but we're testing. Warmth is, of course, it's your body increasing blood flow. We believe that's going to help a lot. Massaging the product, it's all natural, so the body can break it down. The body has 5 hyaluronidases that break down hyaluronic acid fillers, but we're much more apt to break down our own product, our own albumin, because it's already in the blood. Warmth compresses, aspirin, things like Viagra to improve the blood flow. And Hylenex, which is a dispersant, is worth trying too. And we always use large gauge cannulas. But I always say to people, think about the fact of, and you can equate it to whatever you want, but the risk of a bad car accident is 1 in 100, whether you're dead or maimed is 1 in 100. The risk of occlusions are about 1 in 50 to 1 in 100,000. So a very low risk of an occlusion causing bad necrosis. And if you take something that's never occurred in the world before, which is PRF gel, easy gel necrosis, you're probably in good standing, but using a large gauge cannula and being very careful, knowing your anatomy will help. I do believe we're going to come with an enzyme down the road, but I can't say much yet.
Okay. No.
Does that answer some of the, and then you get bruising, you get a bit of redness, but what you don't have is, I don't believe we're going to have any risk of granuloma, of nodules, of the bumps and lumps. And those are much more common side effects with some fillers. I don't think we're going to see any as long as people use clean technique. The face is so vascular, infection is rare, even though people say it's common, it's not. You see surgical procedures in other countries. When I'm over there, I'm shocked at
they're not dead.
And not just other countries. I'm not singling out. I'm just saying I'm shocked at, as injectors, sometimes we're some of the cleanest, putting the cleanest things in faces in the cleanest manner.
Yeah.
And I'm shocked at what the face gets away with. And I ask people, and they say the amount of blood flow lends itself to low incidence of infection.
Yeah.
However, having some bad fillers in the face or certain fillers that get delayed onset nodules is so much worse, and they're so much more common than Easy Gel. So
Yeah.
that's some thoughts.
No, and that's good. And that's exactly why I wanted to bring it up, because people are going to ask those questions. And to that point, this is one of the areas that I'm loving it, as well as those upper lip lines that you talked about, because that is definitely an area that sometimes fillers either look unnatural or can be at a higher risk for leading to nodules. And then just doing a little bit of Easy Gel, maybe throwing in a few little smooth PDO threads on top, can be an excellent natural treatment for a patient around the mouth, where it's not going to change how they look, and then they're not going to be at risk. And for me, the neck too, because I even get a little bit iffy putting biostimulators in the neck, because if there's going to be an issue, that thin skin there. But with this product, it's, the Easy Gel, the threaded throughout, then a bunch of smooth threads right on top of it. I mean, it's a very easy treatment for patients to have done, and I think that's really going to be a home run for the neck and décolleté area.
You're 100% right. And I'll tell you, I get direct messages, and you have a lot of students that I'm sure you hear from. And when it's something in the neck and they say, I'm sending you a picture, I got a problem, 9 times out of 10, it's a biostimulator.
Yeah.
And a lot of them, it's tough because they're not dissolvable.
Mm-hmm.
It's just not. You can do it, and people do it. You can do many things. Should you do them? That's the question. And then it comes to the risk tolerance of the patient. Everything is risk. But I think exactly that in the neck, especially understanding that platysma muscle is so strong. It's thin skin. It's like the under eye skin. And it's why we're not putting as much filler under the eye, which is why we shouldn't be putting as much biostimulator here. Same principles apply.
Yeah, no, I love it.
Yeah, very good.
Good. Well, I think we're going to start to wrap up here, because I know you are a busy doctor, and you're going to be ready to start off your Friday morning.
It's we have a bunch of Easy Gels coming up today. So
that's my first patient today too. Actually, my
my
first one and my last one.
And we tell them to drink some water before you come.
Yep.
I like, on a Friday, I want the girls drawing blood to not have difficult blood draws. And so we have a whole protocol we do, but it's one of the most fun things I think I do in the practice in the clinic. And we always look forward to it.
Yeah, but good.
Okay.
I wanted to thank you for bringing up Viagra recently. It now gives me an excuse to use it. So
Larry,
yeah, we're all
when's
good.
the last time we've done anything with, there's been 2 guys and 1 girl? You and I are always in the room with like 40, 50, 100 women. We're hearing about purses, hairs, lashes, brows. This poor Larry and I. So I had to help the boys out here somewhere.
That's right.
Well, our last
Excellent.
our
Thank
last
you.
podcast was all about enhancement.
Yeah.
So, I mean, he got to start his morning off feeling a little frisky this morning. So led into this one perfectly.
I like that
Wonderful. Well, we'll all be sure and tune into that one.
All right.
Well, good. Well, before we leave, is there any places that you would suggest that listeners could find out more information about the Easy Gel? Have you done any YouTubes on this yet?
I've been slow on it because everyone will be rushing out to get this because I believe it's such a large part of the market.
Yes.
And I don't think a lot of people offer it yet, but we're going to see a lot of people this year and next year as they see how well it works. So I did do one video. I did the top aesthetic treatments of 2022.
Okay.
And there was 3, 2, and my number 1 treatment. So it's hidden in that video from December.
Okay.
Top aesthetic treatments of 2022. And then I have it on the docket to do one. And then just on my general website, but YouTube, you'll see more and more coming. And I think for a lot of people, they can study PRF or plasma eyes that you guys do down there, and the PRF under eyes, and now the lip, and you'll update us on that. So I'm a big fan of YouTube. I think you can, fix your car, you can fix your house, you can learn all about aesthetics. I love it as a platform.
You can fix your face.
Yep.
Fix your face.
Yep.
Yeah, just don't buy the stuff on Amazon and try to do it at home.
No, I get 5 DMs on that kind of stuff every day. It's,
Gosh.
when things go wrong, it's all good. When things go wrong, it's a huge panic. I feel very, very bad for some of those people.
Yeah. It'd be horrible.
Well, good.
Yeah.
Well, thank you again so much for joining us this morning. It was such a pleasure. And if you want to come down and use our training facility at any time to do one of these trainings, feel free.
We're doing it 2022. We already decided. We just have to pin a date down. I'm very excited.
Good.
And I'm missing my window. I want to come during the winter, of course.
Yeah.
But I will come anytime. 'cause
You mean
it's
you don't like
gorgeous down
July in Arizona?
there. Only in your clinic, because it's perfect in there at all times. But no, I go straight back to Canada.
Yeah. Well, great.
Okay.
All
Well,
right.
thank you for having me, and I really appreciate it, and appreciate all the efforts you guys do to educate and everything you're doing down there. I'm always envious of all you get to do, and admire your work.
Well, thank you, and thank you for joining us, and good luck in your day, and have a great weekend.
Yep. And thank you for all the listeners that joined in as well.
Yeah.
Thank you. Have a good one.
All right.
Thank you. Bye-bye.
Bye-bye.